Lakeland Currents, your public affairs program for North Central Minnesota. Production funding for Lakeland Currents is made possible by Bemidji Regional Airport, serving the region with daily flights to Minneapolis-St. Paul International Airport. More information available at bemidjiairport.org. Closed captioning for Lakeland Currents is sponsored by Nisswa Tax Service, tax preparation for businesses and individuals. Online at nisswatax.com.
Hello again, friends. I'm Jason Edens, your host of Lakeland Currents. Thanks for joining the conversation today, and thanks for your ongoing support of Lakeland Public TV. As I said last week, COVID continues to wreak havoc on communities throughout our viewing region, which is why we're having a series of conversations with Keystone Healthcare partners about how they're adapting to the ever-evolving pandemic. It's my privilege to be joined today by the Chief Medical Officer of Sanford, Dr. David Wilcox, as well as CEO and President Susan Jarvis. Thank you both for joining me today.
Thanks for having us.
Welcome to the program.
Really appreciate it. Thank you.
Absolutely. Well, first of all, you and your colleagues have been on the front lines for, 18, 19 months now. How's everyone holding up? How's morale at Sanford?
You know, it's kind of tough right now. We've been at this for a long time. We are still, now we're in the middle of a third surge. And so healthcare providers and people that work in healthcare are really the best people in the world. But people are getting a little tired right now.
I think one of the frustrations that leads to that is we're now understanding that this disease and hospitalizations are preventable. And so that adds another layer of a sense of exhaustion at times, because here's someone who's sick. We maybe could have reduced that. We could have had them have a much better outcome. But vaccination as the way forward is really important. And our community is roughly half vaccinated. So we know we can do better.
So I'm hearing exhaustion, but yet we've just heard from the CDC that the Delta wave nationally is cresting. New cases, hospitalizations, deaths are all trending downward, all the key metrics. That's not the case here in Minnesota, is it?
No, clearly not. And in fact, if we look back over the whole course of this, we've been about one wave behind. So our natural geography, distant living, and those things protected us early through that first wave. So for me, Bemidji's first wave was really the high surge that we had last October. And currently we are already above that surge in terms of number of cases. So this is a serious concern for us in our community at this time.
So this is the worst surge that Sanford has experienced?
This is the worst surge for cases, so but not the worst surge for hospitalizations. Okay. So we have about a third of the number of hospitalizations that we had back in that kind of our first wave. And really it's because we do have people that are vaccinated. And our senior citizens have done an awesome job at getting vaccinated. And if you recall, at the beginning of COVID, it wreaked so much havoc on senior citizens, and so they've become vaccinated. And so what we're seeing now in the hospital is a younger population, and for the majority, the vast majority, are not vaccinated.
And the important part of that is, to me, this has become a disease of the unvaccinated when it comes to hospitalizations and severe illness. Sanford-wide, we keep a lot of these statistics, so that's a large population of many hospitals. 93% of our hospitalizations totally have been unvaccinated patients. If you go to the intensive care and the ventilators, the more serious disease, that's 97% unvaccinated. 97%. So it's incredibly important to reduce that hospitalization and death by getting your vaccines.
So are you at capacity? Is the ICU full right now? Are your ICUs full?
So I would say yes, for the most part our ICUs are full. Not all of COVID. We've had other illnesses and injuries and that type of thing. In Bemidji, we tend to run full in the ICU anyway. We have 10 ICU beds. So that's one of the reasons we're adding 4 ICU beds to our complement of ICU beds that are going to be coming online really, really soon. But throughout the Sanford footprint, our ICUs are full, like COVID and other things.
Please.
Yes, we do have a lot of patients with chronic illness who've let things go over the last year to year and a half. So we're having more admissions related to emphysema, chronic heart failure, diabetes out of control, and other chronic illnesses. So the burden of our hospitalizations now is less COVID, but more other diseases. Nonetheless, we're full, and full is full, and unfortunately, our partner hospitals, those that we generally refer to, are full. So our patients are having to wait longer times than they want. Every day is a busy challenge to take the waiting patients and wait for patients to be discharged before other patients can be admitted. So I don't think our region has really understood this level of poor capacity.
So it's triage. How are you making these decisions on a daily basis? Who gets care?
Well, fortunately, we're not to the level of who gets care or doesn't get care. It's when you get your care. Are you waiting in the emergency room for a couple of hours, or 7 or 8 or more? Or are we able to find a place? And it may not be Fargo, it might be going to a Minneapolis hospital or somewhere else. So far, with us being behind the curve, it's been other places calling us to take patients. So we're helping relieve the state.
Who's calling you?
We've had, within Sanford, we've had calls from outside of the state, from outside of the region, people that just need a hospital bed and have had a hard time finding it, especially those that were experiencing the surge prior to us experiencing this surge.
So 97% of the folks on ventilators are unvaccinated. What impact has the vaccine mandate had on your staff? Have you lost any staff members as a result of the vaccine mandate?
So we have not here in Bemidji. The date for the vaccine mandate for you to be completely vaccinated is November 1. So we are monitoring how many people are vaccinated. We have a process for exemptions for religious purposes and medical purposes and for that kind of thing. And so we are not expecting to lose more than, I would say, a handful of staff. Our staff have really stepped up and gotten vaccinated. And, the reason for the vaccine mandate is, bottom line, is to keep our patients safe. And our staff understand that that's important, and we have to keep our patients safe.
So on November 2nd, do you expect to have lost some staff members?
It's probably, we will, like I said, lose a handful.
And, we have a track record. To Susan's point earlier, our staff are wonderful. They provide great care. They've maintained their composure in spite of being tired. They show up every day and treat people the same way they would have a year ago or 2 years ago or 5 years ago. And so we're really proud of that. A vaccine mandate's not new. Everybody thinks about COVID and that everything is new, but we've had a vaccine mandate for influenza for years. And our staff step forward and are always 90% or plus vaccinated.
So I'm hearing you say you support vaccine mandates, is that correct?
I do, for our business and in the business that we're in. So I think that's important. And that's healthcare, and we understand healthcare and keeping patients safe. The rest of the issue is for our politicians and our public health officials to track down.
And I would just say, we know the vaccines work. I mean, the data just shows. The people that are in the hospital right now, the vast majority of them don't need to be in the hospital, should not have to be in the hospital where they vaccinated. So they work, and they're safe, and we're all vaccinated. And my family is vaccinated, and it just, there is a way out of this pandemic if we choose to take it.
So if these vaccines are effective, why is it that there are several different types of vaccines? There's the mRNA vaccine and a more conventional approach from Johnson & Johnson. Why is that? Why are there multiple paths?
I think it's our researchers and our scientists trying to figure out different ways to approach the same problem. You can relate that to high blood pressure pills. There's different kinds of high blood pressure pills. You can relate that to heart failure pills. And in the past, our vaccinations are of a different variety as well. So it's just part of the natural evolution of science and where our researchers take us.
And did you have the opportunity to choose which vaccine type you received?
We did not really. Early on, vaccines were at a premium and you took what you had. We had Pfizer vaccine because of the significant low temperature storage issue. So as Sanford, we became a regional supplier because we had the proper equipment to store and keep that vaccine in particular. So that was the first one that was out and what we offered to our staff. As the other vaccines came online, of course, there's a place for everything, right? A person who may not be at the best of showing up at the clinic or the hospital, and staying on track for 2 or 3 vaccines might be a better candidate for the Johnson & Johnson single dose, because you have that one opportunity, you better take it.
Sure.
Transporting vaccine like Moderna, which doesn't have a big temperature issue, that's easier if you're taking it around to different places. So it's a matter of supply, demand, and storage, and some of the logistics.
Let's talk about vaccine hesitancy. Of course, there are still many people in Minnesota who are unvaccinated. This isn't the first pandemic we've experienced in the United States, as you've already mentioned. In the 1950s, polio was still very much of a concern until the vaccine was developed. At that time, there was virtually no vaccine hesitancy. What is different today?
That's a great question that I would love to understand. I spoke before, and when we started, I think we did a show with you here a year or so ago, and everybody treats COVID-19 as if it's a brand new science that we're trying to evolve. But basically it's a virus. And whenever society has a new disease that we don't understand or know, we go to some very basic principles. If someone has an infection, you put a mask on them, especially a respiratory infection, so they don't spread it. You isolate them from others. If someone's exposed, you quarantine that person. And with all good luck, you can develop a vaccine. You give the vaccine to reduce hospitalization and death. This has been polio, mumps, measles, rubella, tetanus. There's innumerable vaccines that we've gone through this. So why we've chosen to evolve this in another arena and have all these questions as if it's basically different is a conundrum to me.
The World Health Organization has recently identified both Mu and Lambda, B1167 and C37 respectively, as variants of interest. How prepared are we as a society for another wave of COVID?
I think we again go back to basics. Viruses will find a way to survive. They will mutate just like the flu virus does every year and try to find a way to infect us. If the basic structure and function of that virus is the same, then we have all reason to believe that the vaccines will work. And if they're not working, it's the time to change. So these are variations on a theme, but the basic structure is remaining the same. The most efficient virus will always be the one that spreads. Some might make us sicker, so we need to keep tabs on that. Some might find that killing their host is a bad idea, and so they tend to make us not so sick. But the virus will find a way to continue to change and survive.
So more directly, is Sanford prepared for another future wave of COVID?
We will be there to take care of whatever comes our way. Our staff are resilient. Our physicians are prepared. We are providing, all of the care that is most recent, like monoclonal antibody treatment that we've really stepped up over the past couple of months to help keep people out of the hospital, and then we will continue to provide the information around vaccination and the other things that Dr. Wilcox described about how do you contain and how do you manage this type of virus. But yeah, we will be here and we will be able to take care of whatever comes.
We're all suffering from COVID fatigue in various ways, and of course, you know that better than anyone. Do you think that society, though, is prepared to wrestle with yet another wave? Let me ask you this, is it inevitable that we will have another COVID wave?
I think what we're learning now is what public health calls pandemic, brand new, dangerous, unseen, versus endemic, which means this is a virus that we will struggle with off and on every year like we do influenza. Clearly much more dangerous, 100 times more likely to cause hospitalization or death than influenza, so I don't want anyone to mistake that this is just the flu, which we hear comments about. But we will have to learn to live alongside this virus, as I think where we're going. Only time will tell, but we will, as we've seen with Pfizer, for example, we're learning that immunity may wane a little. It's still incredibly good, but you need a booster, just like you need a booster for your tetanus shot every 10 years. But we won't know that for 10 years. So it will evolve as the science evolves.
Yeah, I think we've had a lot of discussions around this is something we're going to have to live with and we're going to have to be prepared to take care of. It's just, will it continue in waves, or will it become more of a, just a normal number, kind of like the flu that comes around seasonally and that type of thing. And we don't really know the answer to when it becomes endemic versus, the pandemic that we're in now. We do know, and it's kind of like, we keep saying the same things over and over again, but increasing our vaccination rate and will really, decrease the ability for the virus to mutate and to continue to perpetuate in the waves, or at least in the volume that it is right now.
Who should get a booster?
Very good question, because there's a lot of confusion around that. So we have sort of two groups of people to consider. There's people who have serious immune suppressive illness or medicine, and they need 3 shots as their initial series to mount a good response. A normal person so far can mount a good response with 2 shots. Then there's another group that are not always the healthiest, but more the general population, and that's who gets a booster. So the initial series is so far 3 shots of Pfizer or 3 shots of Moderna, but still 1 shot of J&J, Johnson & Johnson. The booster is only Pfizer to date. So we're waiting to see if Moderna gets a booster recommendation from the FDA or if Johnson & Johnson gets a booster recommendation. Right now, due to some limitations of supply, we are giving boosters to those at highest risk, age 65 and up, under 65 with significant medical problems or risk of severe disease, and then children too now from 12 and up for Pfizer, and they're working, of course, on a child vaccine.
The messaging from the healthcare community hasn't exactly been monolithic during the pandemic. There's been some on-again, off-again messaging regarding masking and a variety of other things. Even recently, the CDC had a very public divergence regarding boosters. What kind of message is that sending to the public regarding, confidence in healthcare decisions?
Clearly, when you don't give a single message, it's difficult. I'd say we're seeing a lot more of this play out in real time. So things that physicians and scientists, might debate for 6 months and then come to a conclusion when more information came in to give a single message would happen, much like the vaccines we talked about before. Now it seems to be live on the 24-hour cycle, so the debate occurs in public, which can be very confusing until we get enough information to make a clear message.
And I would just say, even like on the front lines, things have evolved, right? So we started out, we weren't wearing masks, and then we were wearing masks. So we weren't wearing masks. We were taking care of patients, but as the rest of us weren't wearing masks, and part of that was because of the supply chain issue, and we wanted to have enough for the frontline staff to be able to do that. And then that message changed, and so the message is going to change as the science evolves and as we learn more. This is a novel coronavirus, and something that, in our lifetime, we've really never had to deal with before. So I do think it is a lot of what Dr. Wilcox said. A lot of it is evolving, and a lot of it, science is not always cut and dried, at least at the beginning, because you don't have all of the information. And mainly it's just a timing thing. Mm-hmm. Right now, I read an article recently, we don't really know how long natural immunity lasts after you have the coronavirus, and but we do know it wanes, but we don't know the time frame just because that time frame hasn't passed yet, the exact time frame, which is one of the reasons that even if you've had COVID, it's recommended that you get vaccinated.
According to the Washington Post, the United States ranks 43rd in terms of the amount of variants that we genetically sequence. We are far behind many, many other countries. Why is that? And also, what confidence do we have that we know what variants are circulating in our communities because of that?
Mm-hmm. I think it's a matter of some of our communities have mandated we're going to check 15% of all the viruses that we isolate and run a DNA sequence and see what's out there. Others do more community testing, so they'll periodically say, every 1 month we're going to look and do a DNA sequence. So the amount of DNA sequencing probably isn't as critical as the value. Are we doing it? Are we doing it at appropriate times? So I don't know that we have to be number 1 in the world at doing the most sequencing, As long as the virus is staying basically the same and a coronavirus and has much of the same makeup, the treatments and vaccinations will be effective. And that is what we've seen over the multitude. We've tracked probably 15 different variants through most of Minnesota through most of the last year and a half. And you'll see sort of undulating, this virus comes up, it's more efficient, so it gets to be top. We're almost 99% Delta right now for the surveillance testing we're doing. And then Mu or Lambda will come on, and is it going to be more efficient or only half as efficient? So it will wax and wane. As a practical concern, nothing has come along that has changed our therapies. So that seems to be an appropriate amount. And of course, we can take advantage of somebody who's testing more and learn from them if they're ahead of us. As we saw this move from east to west, right?
Sure.
And it took a few months, so we can share our science.
What about vaccine escape? Is that likely?
We'll let Dr.
Will it
Wilcox
mutate?
answer that one. Is it possible?
Clearly anything is possible. You know, the flu virus mutates every year, and some years we have great efficacy, which reminds us that great efficacy for flu is like 50%. And we're arguing over 90% or 80% for these COVID vaccines. So they're incredibly effective, not infective. So just time will tell, and we will continue to observe and see what happens with the long-term immunity that we get from these vaccines.
If we had to endure this again, would you advocate for a longer lockdown? Was that effective in stemming the tide?
I think there's always the choice of, do you isolate and quarantine everyone, or you do isolate and quarantine the right people? And so when you're in a disaster that looks like it will overwhelm your system, you have to do such drastic measures. I think listening to our public health experts and our science experts and having them guide us with some of these principles is very important. I have no doubt in my mind that some of this wave is because of significantly relaxed policies, but if you recognize, what does the relaxation say? Those of you who are vaccinated can take your masks off, so everybody did. You know, I mean, that's what we're really dealing with. In public health, doing a little more is always better than doing a little less. So if we can get 50% of people vaccinated and appropriately masked if they're ill, that's better than 25%. Of course, we always want the best for our patients, so if we can get everyone who's ill to mask up or do these mitigation strategies on their own, that would be the mandate.
I would say I haven't met anyone who wants to go back to being locked down, and so we've got a different way out of this, and I encourage people to take that way, which again is getting vaccinated. And so we don't have to even talk about that again, ever.
So this surge happens to be coinciding, at least here in the upper Midwest, with the start of the school year. And it's my understanding that new cases are more common in younger ages than they were in previous waves. What are your thoughts about how to deal with this in an educational environment?
Yes, I am very concerned about this issue. This is a big issue for us. It's an incredibly large issue for us here in Northwest Minnesota. Under age 12, you can't be vaccinated. A virus likes nothing more than a bunch of kids. All of us who were parents remember that first few weeks of school, all of your kids seem to come home with a cold. So if we do no mitigation, all the kids are going to come home eventually with COVID, potentially. The Minnesota Department of Education gave us some very good guidelines. They recommended masking as the best practice. They left that decision up to the school boards, many of whom have chosen not to vaccinate.
Not to mask.
Excuse me, not to mask. And so, you know, this was a choice, but we're now seeing the outcome of that. So last year during the school year, at the beginning of the school year in October, we had maybe roughly 10 to 15% cases were in the child group. Now with children back in school with no masks, it's 30% of cases are in children of school age. So that is the reservoir, and as long as we have that reservoir of infection, we risk spreading it in that group, which risks spreading it to the other groups, which eventually will affect our hospitalizations. So we did appeal to consider masking as part of our schools in this region. The reason I say it's important for our region is our school children have the highest rate of COVID infection of any of the school districts in the EMS districts. There's 8 throughout the state, but Northwest Minnesota has the highest risk.
EMS, I'm sorry.
Emergency Medical Services defines regions of the state, and we are in the Northwest region. But our region, which has a low level of masking, has a very high level of child infection, and it's the highest in the state.
Again, if we had to endure this again, what would you do differently at Sanford? What could you have done more effectively?
A good question. Now, we have already started evaluating that, and one of the things early on we identified is just some changes to our physical facility. We, I'd mentioned earlier the ICU beds. We've been running at capacity with ICU for a while, and this really strained the ICU capacity even further. And so adding the ICU beds has been important. And then they all need to have the special kind of airflow, negative airflow that we need to take care of people with respiratory issues. Also on our second floor, which is our med-surg floor, we have a lot of semi-private rooms still, and so that's not real conducive to taking care of people that are infectious, you know, putting people in rooms together and not knowing when there's a pandemic going on. And so we're going to fix that too. By middle of next year, we'll have all private rooms with some other changes in the facility and a lot more negative airflow. So from the facility standpoint, we really had some opportunities that we're going to take advantage of. I think that, you know, just we learned a lot around how to, you know, work together to get the supplies that we needed and how to communicate and things like that. But you can always do better around those things with the clear message and just making sure that we're helping the community to understand and interpret kind of that science that's happening. I do think Dr. Wilcox has done an awesome job of being out in front of anybody who'll ask him to come talk about you know, what's going on.
Perfect.
But it has been ever evolving, and you know, we have learned a lot.
Last question for you, Dr. Wilcox. What are you going to do for Thanksgiving? How are you going to deal with the holidays? We only have a couple seconds left here.
Absolutely. We're probably going to still kind of keep it small. We're going to try to make sure everyone is vaccinated. I know my whole family has been vaccinated except for the children under 12. And so we are making those kind of decisions. I think we still need to protect ourselves to some degree. We know that the nature of this is it spreads in groups, so it's kind of been the weddings, the funerals, the gatherings that decided to be a little bit risky. But I think it's important to check who's coming if you would like, and do what you need to do to feel safe. And it's a calculated risk, but which part of that calculation are you going to be on? A little on the safer side or a little more on the cavalier side?
Dr. Wilcox, Susan Jarvis, thank you so much for the work that you've done to keep our community safe, and thank you for joining me today. I really appreciate it.
Thank you.
Thank you.
And I want to thank all of you for joining me once again. I'm Jason Edens, your host of Lakeland Currents. Be kind and be well. We'll see you next week.